brought to you by your neighbour.
Hello and welcome to the TX Leadership Podcast. We are back with another episode, with another guest, and with the incredible co-host that we have, Shamara Fletcher.
Yes, it's so great to be here. Thank you, Michael.
So great to have you here, Shamara. You are a star. And we have a special guest today. And this episode really is going to be focusing on what is probably a hot topic right now.
Yeah.
Very important to every single person in community and society today. And it is to do with the COVID-19 vaccine.
Yes.
And so we're going to be talking about that. We are not going to do it without the help of incredible medical advice.
Yes.
I think it would be wrong to do that. I think we would end up having a conversation of opinions and not facts and truth. And so today we have an incredible guest. I'm so excited to speak to him because we've just been having some good vibes off camera. But we have the one, the only, Dr. Shola. Come on, let's give it a round of applause, Dr. Shola. Yes, great. Yeah, well, you clap for yourself. Yeah. Dr. Shola, we are going to read a bio about you because I feel like we would do you a disservice if we tried to articulate how incredible you are. And so Shamara is going to just read about who you are and what you do, and then we're going to get straight into this interview.
Amazing. So Dr. Shola is a former consultant and gynaecologist with over 25 years of medical experience and a member of the Royal College of Obstetricians and Gynaecologists. He is also the executive pastor at Jesus House, Brent Cross, North London. And Dr. Shola discusses the effect of the COVID-19 vaccines on pregnancy and fertility. We're really interested to speak about that today. So yes, it's amazing to have Dr. Shola with us. It's a privilege and an honor, and we look forward to interviewing you today.
The pleasure's mine.
Jeez. Dr. Shola, let's just get straight into the meat of this.
Okay.
If I'm a young person or an old person, anyone really who's watching this, I guess one of the biggest questions, probably the biggest question out there right now is why should anyone, why should I, why should we, why should you take the vaccine?
There are two answers I'd offer to this. And the first thing is understanding allow me to use the word, the viciousness of what we're talking about, the COVID-19 infection. We've had plagues over the years. They've been quite serious. We've had the scourge of smallpox and measles and then HIV. But I think comparatively, this will be one of the worst scourges we've had in terms of viral infections and pandemics over the years. What a vaccine is immunization. It's just immunizing the body. It's in a sense preparing the body and making the body better able to fight an infection if it did occur. So if you don't mind if I go into it very slightly. So basically, if you were not vaccinated and you contacted the virus, your body has to learn from the beginning how to deal with the virus. Unfortunately, and if you don't mind my going into a bit of detail.
Please do.
So the difference between viruses and bacteria, we all get bacterial infections and stuff like that, but viruses are more clever than bacteria in the way they infect the body, because when they infect the body, they in a sense camouflage themselves so they can get into the body's cells very quickly, and then they start to multiply rapidly. Wow. So much so that by the time the body is recognizing there's a problem and starts to react, oftentimes they spread through the body. That's usually the mechanism. The whole essence of a vaccine is that it introduces, I'm trying to find the right word now, a prototype of the real thing, and introduces in the body. The body will identify the fact that there's a foreign foreign body that's entered its system and marshal a response against it, the antibody response, the way the body fights infections. Yeah. The difference is that unlike the real McCoy, this is a DOD, and I'm just using those words to describe. But the body would have still marshaled a response to it, would have produced antibodies, and then at some point you'll realize, oh, this is really not the real McCoy, this is just a fake enemy in a sense. But it's already done what the body does well, which is to marshal a defense against an enemy. So that if a person who's vaccinated now then gets infected with the real thing, the body already knows the enemy. As soon as it comes and says, I know you, I've known you, I know you from someplace. And more importantly, it's already produced the antibodies. So it's not starting from scratch. It's not trying to marshal up from scratch. It's already prepared. And that's why the vaccine is so important, because it makes a big difference. As I'm sure most people have read, it reduces, certainly reduces the incidence of deaths, because you're better able to fight the virus, reduces the risk of even the reactions you have to the virus. So it does a lot, believe me, for the body.
Wow.
Yeah.
Thank you so much for that explanation, Dr. Shola. So how would you respond to a widespread statement in society, maybe even amongst millennials or younger people, of if I get the vaccine, it won't necessarily stop me from getting COVID? How would you respond to that and bust that myth?
So my response would be, yes, you are absolutely correct, because again, if I go back to what I said at the beginning, a vaccine is not treatment for the infection, it's actually immunization, which is preventative in terms of preparing the body for an imminent attack. Yeah. So if you're vaccinated, remember what I explained earlier, what it has done is it's prepped the body. It's made the body produce antibodies in anticipation, but it doesn't prevent you from getting the COVID infection itself. What it does do is that if you did get the infection, then it puts you in a much better place than if you didn't have the vaccine, because you've got all these antibody soldiers ready to attack the virus and subdue the virus as quickly as possible. In the early days of the pandemic, I'm sure you might have read this, a lot of doctors and medical people, and some of our guys who were in hospital in intensive care told us this, how quickly people deteriorated from 1 minute you're fine, you just have a cough and a headache, and then the next minute it just goes downhill. And that's because of the speed by which the virus overwhelmed the body. With a vaccine, the body is better prepared, like I said, and better able to attack and subdue the virus. So the answer to the question again is that having a vaccine is not meant to prevent you from getting the virus. It's meant to help you suppress the virus if you did get it.
Okay, that's fair. That is fair. So, the question that everyone's asking, is it safe? Because that's what most people want to know, most young people want to know. Is it safe? How can I trust this? Is it safe? And I guess the next question I want to ask you off the back of that is, can you tell us a bit about long COVID? Because I know there's a few people who have got COVID and are still suffering from, unfortunately, what it's done to their bodies. So could you just talk, is it safe? Yeah. And just tell us a bit about long COVID as well.
Okay. Answering whether it's safe, it's a very difficult question, in the sense that there isn't a yes or no answer to it. And the reason is this, and it's important that I explain properly, is that every medication or any medical intervention always has its side effects. And any medication that's put out there in the market, the manufacturers, after long years of testing and all that, would have quantified the risks and the side effects. No medication will be put out in the market if the risks outweigh the benefit. It just doesn't happen in medicine at all. It wouldn't be ethical at all. But usually the idea, and I don't have particular figures, but the idea is to ensure that anything that's put out in society, first of all, the benefits far outweigh the risks. It doesn't mean that it doesn't have any side effects, but even the side effects, the idea is that they're very minimal. And they would range from what they would say mild side effects to moderate side effects and severe side effects and stuff like that. There's no medication that does not have side effects. Yeah. So if when you ask the question, is the vaccine safe? I would come from the standpoint of understanding the benefit over the risks. You understand? Because, like I explained to you, the benefit of having a vaccine far outweighs the risk. You don't want to be left unvaccinated at the mercy of this virus, believe me, from all the things that one is see. But then, in terms of actual safety and side effects, is like I've explained, every medication has side effects. And again, if you allow me to go into a bit of history, yeah, I keep saying to people, vaccines are not new. It's not a new thing that just dropped from heaven like that. We've always had vaccines. I mentioned smallpox and measles and all. But vaccines are usually a response to a viral plague or challenge that invades society. And I think the challenge for us is that here comes this new virus that we haven't had for quite a while. The medical society, the scientific society, scrambles to get a response in terms of a vaccine, and maybe it's a good time to explain what the vaccine really is. Can I do that? Can I explain?
Yeah. Do it.
So basically, like the conventional way of preparing vaccines in the past was you'd get a bit of the virus, an inactivated bit of the virus, or the dead virus, and then you'd introduce it into the body so that the body thinks that it's the real thing, but like I explained to you, it's not the real thing. It's actually an inactivated or dead virus. But then the body responds to the invasion, simian invasion, which is the vaccine, by producing the antibodies. That's really the purpose of the vaccination. Okay. There are side effects from having the vaccine, which are usually as a result of the body responding to the invasion. That's why the common side effects that you would get if you have the vaccine is from the side of injection. It's a no-brainer. If a needle goes in there, there'll be the local reaction in terms of the pain and the ache and all that. But even more importantly is the fact that because the body's thinking that this is the enemy and is producing antibodies towards it, you will get some of the reactions of the immune response. So the headache, the fatigue, some of those. Yeah. Those are generally the mild side effects that you get, and this is common with any kind of vaccine that is introduced. It's not a new thing because of COVID. It's always been the case, whether it was the flu jab or the measles jab or whatever it is. Yeah. I think that's it in the sense. I mean, I'll let you ask me more questions, but I think the answer is that vaccines have always been around. Like I said, the whole idea is just stimulating the body to produce antibodies in preparation for any infection. And like any medication, they will have their side effects. They're usually mild as a result of the reaction to. Now, I must also say before I stop talking about this is that quite a number of times side effects to medication also depend on the individual. Yeah?
Okay.
So when scientists are preparing a new medication to bring into the market, they would usually test them over a range of people. Generally, there would be the healthier population in society that you're testing the medication on. But the idea is to get as wide a range of people as possible, just so that you can see the individual reactions from people. And if you have, say, 1,000 people that have taken part in a trial, that gives you a fair idea of how a range of 1,000 people will respond to things. But then imagine if you had 10,000 people, that's even a wider range of people. So by the time you bring the medication into the market, you have a fair idea, and say you'd be able to say something like, out of 10,000 people, maybe one person will get a severe headache. I'm just using an example. Yeah. But usually you have a rough idea. The point I'm trying to make is that many times it's also a factor of the other person, the person's constitution, underlying challenges and stuff like that. But answer to your question, vaccine is safe like any other vaccine that has ever been manufactured. You do get side effects to them.
Cool. And long COVID, just quickly.
Oh yes, long COVID. Long COVID, very interesting thing because again, with COVID-19, it's a new thing. It's just about less than 2 years in I was going to say in the market, in society. So the scientists in the medical community are learning every day, and it's the same with anything. Incidentally, it's the same with any drug. You bring a drug into the market, or there's a particular infection. You learn as you go along. Yeah. So we're still learning about COVID. You have a viral infection, whether it's mild to severe, and generally you'd expect that people would recover from the infection within a matter of days, 2 weeks, 3 weeks. Long COVID is where you have prolonged reaction response to the infection. Sometimes additional symptoms that develop later on, but usually it's a prolonged infection. So let me give you an example. If somebody came down with COVID-19, the typical symptoms are the headache, the fever, the cough, the tiredness, real bad tiredness. I mean, people have described really being very, very tired and weak and all that. The loss of sense of smell and taste. So those are the typical symptoms. In the majority of people, those symptoms will disappear within 2 weeks, 3 weeks. A young gentleman, I was talking to him a few days ago, 18-year-old, who came down who tested positive and had some of the symptoms. And then he said to me, Uncle, how long do you think it will take for me to get better? And I said, usually 2 weeks, a week, 2 weeks, usually that's the average. Yeah. Then we found over the last 15, 16 months that some people just have prolonged symptoms. Prolonged tiredness. They've come over the acute bout of the illness, might even have tested negative, but just continue to have those symptoms. Excuse me, I'm moving this around. So that's really what long COVID is, just prolonged symptoms well after the expected duration that a person should react to.
Okay.
Wow, just so informative. You know, it's just so important to get the right information, isn't it, Michael? Like, it's just so important. And I guess that leads us to our next question. Why are there different vaccines? And which is the best for younger people?
Okay. Why are there different vaccines? There are different vaccines because really there are loads of medical communities all over the world. And don't forget, this is something that hit the whole world. So there are loads of medical communities all over the world that were scrambling to find a solution. So I think the simple answer is that in the UK, obviously the UK government challenging the medical community find an answer to this the same way they would have been doing in the US, in China. And it's just different medical communities, scientific communities, scrambling to find a solution. Different pharmaceutical companies trying to find a solution. That's really the simple reason why there are different vaccines in terms of being produced from different places. But in terms of the what's it called, the science behind it, the traditional method of producing vaccines, like I explained earlier, over the years has always been where you take a little spike of the protein from a dead virus and introduce it through a vector into the human body. That's been the traditional method.
Yeah.
But I'm sure you know, science has developed quite a lot over the years.
Yeah.
In the same way, we were doing a workshop many months ago, just answering questions about this, and one of my colleagues, who was a scientist, was saying, a lot has happened technologically in the last 20, 25, 30 years. It's been an age of technological advancement. The mobile phones have evolved, and she was saying, why do you think the same wouldn't happen with science? So science has really evolved over the last few years. And I understand that over the last 10 years particularly, scientists have actually been working on this kind of viruses and trying to find more efficient ways of producing vaccines.
Okay.
And the technology behind it is, whereas in the past, remember what I said is that to produce a vaccine, you got a sample of a dead virus and then introduce it back into the body to trick the body into thinking this is the enemy, whereas it's just opposite. So what science has done this time is that rather than taking the dead virus, you produce a synthetic version of the spike protein of the virus. So you study the chemistry of the virus, what's called, and you produce that in the lab. This is synthetic, because there's
I've never heard this, doctor. This is really good.
The part of the virus that really penetrates the body, and I'm just simplifying this, is what's called the spike protein on the tip of the virus. You would have seen the pictures on TV, with the spikes and all that. So you produce a synthetic version of that using mRNA, messenger RNA. Okay.
Scientific.
Yeah. So, just long story short is that rather than injecting dead virus, you produce a type of the virus from the lab using the mRNA, and then introduce that into the body. The essence is exactly the same thing. It's to make the body think that it's been invaded by an enemy and get the body to respond by producing antibodies. So same pathway, but different, how should I say it? Different, how should I say it?
I don't know.
Okay, so let me put it another way. So same response.
Okay.
Yeah, but different pathways. That's what I was trying to say.
Okay.
Yeah.
So different route.
Yeah.
Yeah.
So it's, we say different vaccines because one was produced by AstraZeneca, one was produced by Pfizer and all that.
Yeah.
Yes, they are different because AstraZeneca uses the old method of vaccine production, which is using the dead spike protein from a dead virus. Whereas Pfizer and Moderna use the mRNA technology. That's a new technology.
Okay.
All right. Cool. Let's get school today. Yeah. All right. Yeah.
You make me feel like I haven't been saying it.
No. Well, listen, we're hearing you. We're with you.
Yeah. So that's really the principal difference between the two types of viruses. The answer to the second bit of your question is which one is better. Yeah. Okay. So from where I'm sitting, there really isn't any difference between any of the viruses. And the reason is because it's not the methodology that matters in terms of how you produce the vaccine, whether it's using the dead virus or they're using the mRNA. It's the effect it produces in the body that matters. And both types of vaccines are geared towards producing the same results. It's exactly the same thing. It's just to make the body think there's a foreigner coming in, you need to do something, the body produces antibodies and then realizes, oh, actually, you're not the real thing, but it's now prepared for the real thing if it were to come. So the effect is exactly the same, regardless of the method of production.
Thank you.
Having said that,
Okay.
because the question was which one was better for young people.
Yeah.
Okay. So over the last few months and year, obviously in monitoring, because with any new thing that's introduced in the market, obviously the scientific community are monitoring, we're learning every day about the virus and the vaccine. And I'm sure you heard a few months ago where there were a number of incidents of blood clots associated with the AstraZeneca vaccine. Again, if you permit me to digress slightly, these are some of the things that unfortunately lend to misinformation, because when we get information, we don't put it in perspective. So the news reports and says 30 people reported with blood clots. Yeah. What they don't tell you, or what they don't put out there, is 30 out of 30 million. Now, 30 out of 30 million is very, very insignificant. What they also don't say, they don't break down, is this 30 might have had certain underlying conditions or certain predisposing factors that make them susceptible to blood clots. So for example, and this is just going medical, in general population, there's some people that are more predisposed to producing blood clots than other people.
Okay.
If you and I traveled to China and back, long haul, 18 hours on the flight, there's a risk of developing clots just by sitting down on the plane for a long period of time. But one person might be more predisposed than the other person. And it's the same in general population. So the point I'm trying to make is that even though the scientific community was concerned that there were incidents of blood clots, the truth is that if you broke it down, you might find that those 30 people were more predisposed anyway to blood clots than you and I. It just so happens that they had the vaccine and they developed blood clots, but guess what? You blame the vaccine for it. But to be safe, as all is, because this is the responsibility of the government and medical community, as you're monitoring a drug that is being newly introduced into society, you have to put these things into consideration. You can't discountenance them. So because of that, the reports of the increase in blood clots that were noticed particularly among a younger cohort of people, the advice was then to say, you know what, to be on the safe side, let's not give AstraZeneca to young people, let's give Pfizer. Okay?
Right.
Okay.
So that's the reason why the Pfizer has been given to the younger population now.
Cool. So, Dr. Shola, this has been really good so far. What are the benefits to wider population of an individual getting vaccinated?
Okay.
Like, what are the benefits?
The simple answer to that is we advise people to get vaccinated, first of all, to protect yourself, because based on everything I've explained, you protect yourself if you're vaccinated, so that if you were to get infected by the virus, your body's better able. But as importantly is that it's also to protect other people. The reason simply is that if you're vaccinated, remember we said that it doesn't mean you can't be infected. But the thing with viruses is that they're constantly looking for new hosts to develop. And that's why we keep getting variants, because the virus will, for as long as it finds people to infect, it will keep, It'll keep changing, yeah? So the benefit is that you protect yourself, like, in terms of vaccination, but you also protect other people, because if you're vaccinated, then you're less, you're less likely to put other people at risk. It's as simple as that. So it's not just it's not for me. If you don't get vaccinated and you get infected, you're going to put other people at risk.
Simple.
Simple. Thanks for that, Dr. Shola. So, what would you say to people who might have the question that the vaccine has been rushed? Is it trustworthy to take? Why has it been produced so quickly?
In medical science, research is always going on. So, I say apparently because I'm not a virologist, I'm a gynecologist. Apparently, within the scientific community, there's always been research going on about viruses like this. So a lot of work had already been done, as the scientific community always does. Just researching, looking for things.
Yeah.
That's number one. Number two is that there are about 3 or 4 stages. I won't go into the details because of them. There are 3 or 4 stages that any medication that's going to come to the market undergoes. 3 stages of trial. So you have the very first trial with a low cohort. You just want to see how effective this thing is. And then you try a larger cohort to see the side effects, like I mentioned earlier. And then a much larger cohort to see how it will play out in a larger population. Alongside the clinical trials are very important. Alongside the clinical trials, what you call certification by the medical board. So if I did a clinical trial on 20 people, I must submit the report to the governing councils and all that. They will scrutinize. Now, all of these things under normal circumstances would take 6 months because of bureaucracy. It would take years because of funding. But all of a sudden, we have COVID-19, a deadly virus that affects the whole world, brings the economy to a standstill. Guess what? Everybody responds. So the government throws money at it and just says, get this thing done, cut out the bureaucracy. It wasn't cutting out the clinical stages, it's cutting out the bureaucracy, the lack of funding that usually attended. And very quickly, let me just mention, because we were chatting with one of the ladies at AstraZeneca who was responsible for the clinical trial. And she said, it's quite amazing because normally when you're trying to get trials through, you beg, you knock, can you fund us for this? All of a sudden, they're throwing money from the government and she's flying here and then helicopters and all that, because this was a worldwide emergency. So that's the reason why it wasn't rushed in terms of the stages of the clinical trials. It's just that a lot of red tape was cut.
Fair enough, man. Fair enough. Wow. Okay, so we're gonna kind of wrap this up. There's just a couple more questions we have for you.
No problem.
And one of them is, what are your views on the vaccine passport? Obviously, more recently we've seen all kinds of things. I read in the newspaper today, kebabs for jabs, all kinds of promotions to get people to get vaccinated. Do you think this will encourage more younger people to do so, or do you think it'll put them off?
Okay.
Yes.
So the promotions are different from the passport. So the promotions are just incentives to encourage people to get vaccinated. We had in the news in America, they were offering young people $100 to get vaccinated. They're just incentives to get people vaccinated. And the reason I can understand from the government's point of view is, if everybody doesn't get vaccinated, this thing's not going to go away. It's just going to perpetuate and what's called. Meanwhile, more people are being put at risk. Some people are going to die, unfortunately, and all that. So I think the government is trying its best to encourage as many people, and just looking for incentives to get people vaccinated. Now, the vaccine passport, on the other hand, is where they're saying only those who have been vaccinated will be allowed into certain environments that are risk environments. And the reason, again, is that you want to minimize the risk from people. So if there's an event of 100 people and 100 of you are vaccinated, what they're saying is that there's less likelihood of the virus perpetuating in that environment than if you had an event of 100 people, 50 are not vaccinated. They may already be infected with the virus. And if they're not, and they get infected, because they're not vaccinated, remember, the results are a lot more severe than in the vaccinated. So I think these are all methods of just trying to curtail the infection and protect people. There's something I was going to say about things. Yeah. Talking about the incentives, I think it's great to incentivize people.
Yeah.
I think it's a desperate measure, offering give out and all that.
Yeah.
I think the biggest thing to do, which wasn't done properly from the beginning, is just information. And that's one thing that I don't think we did very well from the beginning in terms of communicating. It was just like, hey, we've got a vaccine, take the vaccine. And then for young people particularly, it's like, why are you forcing me to take the vaccine?
Yeah.
Instead of explaining that this is the reason, this is the benefit, and counteract the myths, a lot of the anxieties and stuff like that. And,
Cool, fantastic. We want to just finish up with this last question, Dr. Shola, and it's more so to do with what you kind of like talk about regarding COVID-19 vaccines. And I know there'll be a number of young ladies who are watching this and will have concerns about the impact or the effect of the vaccine on pregnancy for them in the future and their fertility. So could you just speak into that just very quickly about the effects of the vaccine on pregnancy and fertility?
Okay, so maybe to start by just saying it's understandable that people have concerns. Remember, we all had concerns at the beginning because new vaccine has been introduced. But like I said, vaccines themselves are not new in terms of the concept. So it's understandable that a lot of young ladies particularly have had concerns about the vaccine. The answer is that as we speak, which is close to 2 years down the line in terms of knowledge about the COVID-19 infection, as well as the vaccines. Number one, don't forget what I said earlier on, risk versus benefit. The benefit of having the vaccine far outweigh the risk of coming down with the infection, whether in pregnancy or otherwise. Yeah, that's number one. Number two is that as we speak, there hasn't been any associated effects of the vaccine on fertility or pregnancy.
Brought to you by your neighbour.